Hi, welcome to Bright Star Academy. In this lecture, we'll be looking at specificity and sensitivity. By the end of this lecture, we'll be able to understand why diagnostic test is very important, especially in clinical medicine. We'll also define sensitivity and define specificity and explain their significance in diagnostic test evaluation. And lastly, we will learn how to calculate sensitivity and specificity using the right formulas. One of the primary purposes of diagnostic tests is to identify and diagnose diseases and also medical conditions. These tests they help the healthcare providers to confirm or to rule out specific diseases based on the clinical symptoms or based on the risk factors. Diagnostic tests can often detect diseases at an early stage even before noticeable symptoms appear, and this early detection can lead to a more effective treatment and even improved outcomes. Also, these tests are used in population-wide screening programs to identify individuals who are at risk of certain diseases like cancer, diabetes mellitus, hypertension, and other chronic diseases. So, early detection through screening can lead to early intervention and also prevention. For individuals with chronic conditions or ongoing diseases, these diagnostic tests are essential for monitoring disease progression. So they help healthcare providers to kind of assess treatment effectiveness and also to adjust therapies if needed. Diagnostic test provides information that serves as a guide, to treatment decisions. So they help to choose the most appropriate therapies, the most appropriate medications, or even the most appropriate intervention based on the specific characteristic of a patient's condition. And some of these tests they assess a patient's risk of developing a particular disease or condition. So this information can be very useful, when implementing preventive measures or lifestyle changes to reduce the risk of developing that condition. In cases where different diseases or conditions have similar symptoms, diagnostic tests can help to differentiate between them. So this ensures that patients receive the most appropriate treatment, and diagnostic tests serve to confirm or to validate clinical findings. So they provide kind of an objective data that supports a clinician's observation or a clinician's suspicion. And lastly, while undergoing treatment, patients may experience side effects or complications. So diagnostic tests help to monitor these effects and provide a guidance, to kind of adjustments in the treatment plan made by the healthcare provider. If a patient has the disease and the test result is positive, we say it is a true positive result. But if a patient does not have the disease and the test result is positive, we say it is a false positive result. Also, if a patient has the disease and the test result is negative, we say it is a false negative result. However, if a patient does not have the disease and the test result is negative, we say it is a true negative result. So in sensitivity, we are looking at the proportion of individuals who truly have a disease or condition and are currently identified as positive by the diagnostic test. So that means that the diagnostic test is good, at detecting those who actually have the disease. Invariably, this means that 100% sensitive test will not have any false negative results. So mathematically, sensitivity is equals to true positive divided by true positive plus false negative, where true positives are the individuals who have the disease or condition and the test correctly identifies them as positive, and false negative means individuals who have the disease or condition but the test incorrectly classifies them as negative. So these are cases that the test misses or fails to detect. Sensitivity is typically expressed as a percentage, or it could be expressed as a proportion ranging from 0 to 1, or from 0% to 100%. So a higher sensitivity value indicates that the test is better or very good at correctly identifying individuals with the disease, and it is less likely to produce false negative results. A test with high sensitivity is good at identifying true cases of the disease. So sensitivity is very important when missing when we miss a true case of a disease. There could be severe consequences, such as in infectious disease or in cancer screening. So sensitivity helps to avert this consequence. So mathematically, using the 2 by 2 table, where A is equals to true positive results and C is equals to false negative results, sensitivity is equals to A divided by A plus C. And remember that we can present this result as a percentage or as a proportion. So by moving this graph to the left, we are reducing drastically the number of false negative results. Thereby, we are achieving a higher sensitivity. Remember that we say that 100% sensitivity means that there is nearly no false negative result. So, but there could be a lot of false positive results. So by increasing the proportion of these false positive results, it invariably means that we are reducing the specificity of the diagnostic test. So specificity measures the proportion of individuals who truly do not have the disease and are correctly identified as negative by the diagnostic test. So that means that the diagnostic test is very good at correctly identifying those who are actually disease free. So 100% specific test will not have false positive results, although it may have high rates of false negative results. So we say specificity is true negative divided by true negatives plus false positive, where true negatives are individuals who do not have the disease or the condition and the test correctly identifies them as negative, and false positive means individuals who do not have the disease or condition but the test incorrectly classifies them as positive. So specificity is just like sensitivity is also expressed as a percentage or a proportion, and a higher specificity value indicates that the test is very good at correctly identifying individuals without the disease, and it is less likely to produce a false positive result. So a test with high specificity is good at identifying or reducing the number of false positive results, and this is very important in situations where false positive can lead to unnecessary anxiety or follow-up testing, just like in breast cancer screening. So using the 2 by 2 table, where D are the true negatives, that is those individuals who do not have the disease and are correctly identified as negative, and B false positive, that is those individuals who do not have the disease but have been classified as positive. Specificity mathematically is equals to D over B plus D. So by moving the graph to the right, we are drastically reducing the proportion of false positive results. When the proportion of false positive results is 0, that means the diagnostic test has 100% specificity. But recall that we say that 100% specificity may give room to a higher number of false negative results, and by increasing this proportion of false negative results, it invariably means that we are reducing the sensitivity of the diagnostic test. So a high sensitivity means few false negative results. That means individuals who actually have the disease but have been classified as negative. So this can lead to many false positive results. That is, individuals who do not have the disease but have been identified as having the disease, and this invariably reduces the specificity of that diagnostic test. On the other hand, a low sensitivity means a lot of false negative results. That means individuals who actually have the disease or condition but have been classified as negative. However, this could lead to few false positive results. That means identifying individuals who do not have the disease and classifying them as having the disease. This could also increase the specificity of the diagnostic test. When a diagnostic test is highly sensitive, it means that a negative result rules out the diagnosis. That means that the diagnostic test is able to identify individuals who actually have the disease and classify them as positive. So the chances of identifying individuals who have the disease and classifying them as negative is minimal or even zero. And when it is zero, we say that this diagnostic test is 100% sensitive. So in this scenario where this test has identified only 2 individuals having the disease and classifying them as negative, when we put this in this mathematical formula here, it gives us a sensitivity of 0.99. that is 99% sensitivity. And when it is 99% sensitivity, it means that this diagnostic test is very good. It's 99%. It has 99% chances of identifying individuals who actually have this disease or condition, and we classify them as positive. Also, when a diagnostic test is highly specific, it means that a positive result rules in the diagnosis. That means that the tendency of the test identifying individuals who do not have the disease and classifying them as positive is reduced or almost absent. So when it is absent, we say that the diagnostic test is 100% specific. So in this scenario, we have 7 individuals who do not have this disease or condition but have been classified as positive, and when we put it in this mathematical formula here, it gives us 0.965, that is 96.5% specificity. And this means that this instrument is very good at identifying individuals who do not have this disease or condition and can classify them as negative. So high sensitivity ensures that true cases of the disease are detected, and this is particularly important for diseases where early detection is very, very important, such as in cancer or in infectious diseases. So a test with a high sensitivity helps to identify individuals who actually have this disease and need immediate treatment for further evaluation. High specificity also reduces the chances of false positive. So it reduces unnecessary stress, unnecessary costs, and unnecessary follow-up testing for individuals who do not have the disease. So specificity is very important in ensuring that patients are not wrongly labeled as having the disease. So the diagnostic test is very good at identifying individuals who do not have the disease and classify them as negative. So in cases where treatment have potential side effects or the treatment is expensive. High sensitivity helps to avoid missing patients who genuinely need this treatment. Let's take, for example, in HIV testing, missing true cases can lead to severe consequences, and using a very sensitive diagnostic test is very, very important to avert these consequences. Also, high specificity is very important in preventing patients from undergoing unnecessary treatment or unnecessary intervention or surgery. So high specificity ensures that only those with a confirmed diagnosis receive the required therapy. High sensitivity provides kind of a reassurance to the patients by increasing the likelihood of detecting diseases in their early stages when they are more manageable. So it prevents the disease from going on to the late stages, and this can lead to better prognosis and improved health outcomes or quality of life. And high specificity reduces the likelihood of false alarms. It prevents unnecessary anxiety and stress for patients who do not actually have the disease or condition. High sensitivity can lead to early diagnosis and treatment, like we mentioned, and this potentially also reduces long-term healthcare costs. It prevents the progression of diseases through early detection, and this can be more cost-effective than managing the disease when it is already in the advanced stage. And high specificity reduces unnecessary healthcare expenses that are associated with follow-up tests, treatment, and consultation. Imagine telling a lady who have no cancer that she has cancer. So this is unnecessary waste of resources, where there may be surgeries or follow-up visits, and in the real sense the individual has no breast cancer. So specificity helps to reduce unnecessary healthcare expenses that are associated with all these follow-up visits. High sensitivity is very important in surveillance and also in screening programs. It helps us to identify cases of infectious diseases or emerging health threats easily. So detecting and isolating individuals who has this disease condition can help control outbreaks. Just like when we had the COVID-19, it was very important to use diagnostic tests that were very sensitive, to easily isolate individuals who actually had COVID. And high specificity ensures that public health resources are efficiently allocated to those who genuinely need them. Imagine treating someone who does not have COVID with all the PPE and all the resources when the individual actually had a minor flu and not COVID. So ensuring high sensitivity is ethically important when missing a true case of a severe disease, and this could lead to significant harm or transmission to others. So when we miss most of these infectious diseases, when we miss it, it can worsen its spread, and then other people get infected, and this can impact on the healthcare costs. And high specificity is also important in reducing unnecessary treatment, so it reduces unwarranted treatment. So to summarize everything that we've just discussed, we say that sensitivity is the probability of the test to be positive in those who have the disease for all diseased cases, and specificity is the probability of the test to be negative in those who are healthy in all healthy cases.